My name and position is Wiqqas Jamil. I'm a consultant trauma and orthopaedic surgeon who specializes in surgery of the knee and the hip. I decided to become a doctor at a very young age due to personal experience. Since the age of 14, I've seen my father undergo major health issues, and at the age of 16, watched him undergo, not physically, open heart surgery. To this day, I remain in awe of the healthcare professionals that still look after my dad. And I essentially wanted to be in a position where I could help other people and families and make a difference to their lives. And I specifically wanted to be involved in the diagnostics, the planning and active delivery of treatment through the physical intervention of surgery. And that's why I decided to become a surgeon. What made me choose my specialty was the variety that it provides and the link with sports. For example, I can do open procedures, I can do keyhole procedures, I can do simple minor procedures, I can do complex major procedures. Having been a keen sportsman all my life as well, albeit to a lesser degree now, I can deal with sports injuries, including ligament and cartilage tears, meniscal tears, and was an additional draw for me, which still is to this day. What I find most rewarding about my job is the fact that I do feel very blessed in having the ability to make a difference to people's lives. Seeing someone debilitated by a ligament injury or osteoarthritis or any other injury is not something that's nice to see, but making them better and knowing that I've been able to change their lives for the better is actually the most rewarding aspect of my job. What my patients value most about me, as can be corroborated by my testimonials pages on my website, is that I'm a very approachable person. I explain issues well and I formulate management plans with backup plans in line with the patient's wishes. And I then execute these surgical plans with a high level of competence and patient satisfaction. Ultimately, it's widely recognized by patients and colleagues that I treat my patients as one of my own. If it isn't good enough for me or my family, then it isn't good enough for my patients. There are two catchphrases that I'd say I'm relatively well known for. The first one would be, if it isn't broken, don't fix it. But the other one that I use quite frequently is, if it's not good enough for me or my family, then it's not good enough for my patients. And I live by those two catchphrases in my practice.